And Ohio is in stage 1A of its vaccine rollout, focusing on nursing homes and frontline workers right now.
Yeah, and Summit County officials are working to get as many of them vaccinated as possible. And today, News 5's Bob Jones takes a look at what's being done and why some are choosing to roll up their sleeves.
Flames and smoke, the enemy's firefighters know. But for the past 10 months, those who battle blazes have also tried to evade an invisible enemy they didn't know, COVID-19.
We want to make sure that this pandemic, the proportions, the incidences, the occurrences go down for all of us.
Akron Lieutenant Sergi Lash received the COVID-19 vaccine about 2 weeks ago. With the exception of some shoulder soreness, she has not experienced any side effects.
There was a waiting period, a waiting area for 15 to 30 minutes after the vaccine was administered so that everybody can check and health officials can check and see if any side effects did occur.
About 700 public and private EMS workers among the first in Summit County to get the initial dose of the Moderna vaccine.
It's not mandatory, but it's encouraged because we're in a pandemic.
The firefighters who received the first dose of the vaccine will get a second dose. For now, that's scheduled for January 23rd. You ready for the second dose? No hesitation.
I've got no questions right now.
Chris Barker from Summit County Public Health says the agency has received about 3,400 doses so far, administered 1,800. The rollout remains in phase 1, which today shifted to a drive-up site to vaccinate up to 900 developmentally disabled or those who work with them.
We're going as fast as we can in an organized manner as possible.
Barker says those working for private physicians, dentists, pharmacies, and mental health organizations are next on the list as long as the supply is there.
There's going to be challenges with getting vaccine. I mean, it's just the reality of this situation. So we're happy to receive what we have.
Barker stressed area hospitals have their own allotments to vaccinate their healthcare workers. By February, the hope is residents over the age of 65 will be able to get their shots.
We have to see how allocations will ramp up into the future.
As far as getting the vaccine into the arms of the rest of us, Barker believes that should start in the spring.
We have access to this critical resource, and we want to get this out to the public as soon as possible.
In Akron, Bob Jones, News 5.